let me just say a couple of words about the first speaker. Donald Alexander is a senior advisor on food claims at the New Zealand Food Safety Ministry of Primary Industries. She's a nutritionist by education. And Donald, I leave you the floor for this first speech. Thank you. You're probably muted.
Thank you. Can you hear me now? Good morning, everyone, and it's a pleasure to be joining you here at the Parma Summer School. I'm going to be speaking to you today about substantiation of the health claims in New Zealand. But firstly, can't seem to change my slide. Oh, there we go. We call ourselves Aotearoa New Zealand here because Aotearoa is the name for New Zealand in our Indigenous language, Māori. And we are here at the bottom of the world for anyone who doesn't know where we are, some distance from most other countries and probably about as far away from Parma as you can get. We have two main islands and we're known for our beautiful scenery, whether that be in the and I'm not able to, oh, there we go, in the North Island for our beaches or in the South Island for our mountains. But I'm here to talk about regulations. So our food regulatory system here in New Zealand, we share standards for food labelling and food composition with our nearest neighbour, Australia. More than any, so this makes quite a lot of sense because we export to and import food from Australia more than any other market, and we have very close economic relationships with Australia. But not only is Australia much bigger than us, they have 8 separate states and territories and jurisdictions in addition to their federal government. So while New Zealand is one of 2 countries in our joint regulatory system, we're only one jurisdiction amongst 10 when it comes to setting, implementing and enforcing our regulations consistently. My employer, New Zealand Food Safety, is the organisation which upholds the regulations here in Aotearoa, New Zealand. So to talk a little about health claims, it's one example of our joint regulation across both Australia and New Zealand. But in New Zealand and with New Zealand-based food businesses, New Zealand Food Safety is responsible for enforcing the regulation. Before I can explain about how health claims are substantiated here, it's necessary to first briefly describe some key aspects of our health claims regulation, Standard 1.2.7. It's a relatively new regulation, which was finalised 9 years ago after more than 12 years in development. And after a 3-year transition period, it's been in place fully enforced for the last 6 years. So we now have a good amount of experience in enforcing this regulation to draw from. We have 2 characteristics in our health claims regulations that are reasonably unique worldwide. The first one being that food must be considered to be healthful enough to be able to carry a health claim. So that is, it must meet strict nutrition profiling criteria. So not all foods are eligible to make health claims. And secondly, that some types of claims can be self-substantiated by food businesses in a process that does not require pre-approval. So I'll explain more about the second aspect and how we evaluate this requirement more later in the talk. But overall, when the regulation was finalised, it balanced the need for industry to innovate while providing consumers with a wider range of healthier food choices with proven health benefits. So because we define health claims a little bit differently from how they're defined in other countries, I need to briefly outline this before explaining our requirements for health claims. The standard covers both nutrition content and health claims. Nutrition content claims I won't spend much time on, but they're simply claims about the presence or the absence of a biologically active substance or a nutrient or a glycemic index rating. They don't explain any effect on health. High-level health claims are claims referring to a serious disease or an established biomarker of a serious disease. So they relate a food or food property to a lowered risk of developing a disease or a biomarker of a disease. And general level health claims are claims about the maintenance of health, well-being, and they don't really refer to, they definitely don't refer to a serious disease or a biomarker, but they do refer to a nutrient or a substance and a food or in a food that has an effect on a health function. In some countries, these are called nutrient function claims. So you'll hear me also talking about food health relationships. These are the established relationships between a food and a health effect. Our regulation doesn't prescribe the wording for health claims, but rather the food health relationship. So health claims need to be based on the food health relationship and have an equivalent meaning. For example, a food health relationship for calcium and normal tooth and bone structure exists, though a claim about this using that food health relationship could read something like, this food is a good source of calcium, which helps maintain healthy bones and teeth. So what options are there for health claims in Aotearoa New Zealand? Well, we have a range of pre-approved food health relationships. So pre-approved, meaning that they're sitting there in the standard. There's more than 200 general level health claims and 13 high level health claims. And these can be made for any eligible food without the food business having to provide any evidence or notifications, because the evidence has already been confirmed by our food standards setting agency. When the claim that a food business wants to make, though, is not on that pre-approved list, they have two options. Firstly, they can apply to modify the standard and have a new food health relationship added for either a general level or a high level health claim. Or secondly, they can self-substantiate a food health relationship, noting that this is only a possibility for a general level health claim because high level health claims cannot be self-substantiated. So for general level health claims, there should be no difference in the robustness of the evidence between self-substantiated and pre-approved claims. The only difference is that the scientific assessment for the pre-approved claims is done by our food standards setting agency, Food Standards Australia and New Zealand, while the scientific assessment for the self-substantiated claims is the responsibility of the food business that notifies the food health relationship. For self-substantiated claims, the requirement is for food businesses to compile a dossier of evidence to meet regulatory requirements, which I'll talk a lot more about shortly, before notifying us of the newly established food health relationship. Part of the notifying process involves the business verifying that they have met all of the regulatory requirements with their dossier of evidence. Once they've notified, they can proceed to make a general level health claim on their food based on the notified food health relationship. So we at New Zealand Food Safety provide detailed and tailored guidance about what food businesses need to know to compile their evidence to meet the regulatory requirements and to help companies get to the point of notifying. But once a company notifies us of their food health relationship, we formally evaluate their dossier of evidence. And if we're not satisfied that they've met the regulatory requirements, companies are given the option to either correct their dossier of evidence or to withdraw their claim, or we can take enforcement action to have claims removed. Bear in mind that because this is a joint standard with Australia, notifications can come from food businesses based in both countries or in either country. So as the New Zealand Enforcement Agency, we only evaluate the dossiers from New Zealand-based companies. So what are the regulatory requirements to self-substantiate a general level health claim? Well, food businesses are required to compile a systematic review of all evidence, including a specific list of requirements for each step in the review process and detailed information about the foods which carry the claim, and to confirm that this fits within our population's diet. So this slide shows a standard definition for a systematic review that I'm sure many of you will be very familiar with. Clearly, a systematic review is far more than a collection of favourable studies. And in fact, our regulation also requires a lot of very specific things to be documented within the systematic review that are often not included in standard systematic reviews. So we have completed and recently updated this detailed guidance document for people who are hoping to meet the regulatory requirements for a self-substantiated general level health claim. And this is available on our website at this address. And I understand that you will be getting these slides when they're ready shortly. So due to our specific requirements, when we evaluate dossiers of evidence, including systematic reviews, we need to consider all of the following aspects. Firstly, the food health relationship and the review question must be established. There must be a clear description of the food health relationship, the food or the property of the food, and the health effect, including how each of these are most appropriately defined and measured. Details of the food holding the claim need to also be provided to ensure that the property of the food, which is the subject of the claim, or the systematic review, I should say, is included in the correct dosage, and that there's no potential interactions within the food matrix which could affect the food health relationship. The protocol for the systematic review, in terms of search terms, databases, and the inclusion and exclusion criteria, then need to be described, and this is pretty standard for systematic reviews. Once the literature search is undertaken, the authors must sift potentially thousands of studies through the review protocol in order to identify the most relevant studies to the review question, removing any duplicates or non-original research. This must be adequately described, and again, this is reasonably standard for systematic reviews. Once all the relevant studies have been found, all of the data relating to the review question needs to be extracted so that the direction of the relationships can be assessed objectively. So the regulation specifies exactly what data, at a minimum, need to be recorded for all of the included studies. Then this aspect is the most unique and important part of the systematic review requirements of our regulations, that at least 6 specific aspects of study quality must also be carefully evaluated to give an overall rating of the study quality. Some of these are not found in quality assessment tools. So the 6 minimum requirements are that the study has a clearly stated hypothesis, that bias has been minimised appropriately, that there is adequate control for confounding, that the background diet and other relevant lifestyle factors have been controlled adequately, that the study duration and follow-up is adequate to demonstrate the health effect, and that there is sufficient statistical power to test the hypothesis. So as you know, each of these can be very complex and differ in importance depending on the design of the study. So assessing bias alone involves looking at many different types of bias. Controlling for confounders is especially important with observational studies. And as I mentioned, there is no study quality assessment tools that cover all 6 aspects together across a range of study design. So our preference is for there to be a detailed qualitative assessment of each individual included study, and that takes into account all strengths and limitations for these 6 aspects at a minimum, weighing them appropriately against each other to conclude whether each study has a low, medium, or high quality ranking. The quality ranking is really important because only high quality studies can be used later on in the process to establish a food health relationship. And this is the area where most dossiers that we review fall short of the requirements. So once this is done, the results from all studies are synthesised appropriately, weighted by quality, and causality can be assessed from the high quality studies alone. A meta-analysis is not actually a requirement of the regulation, but it's often done if the nature of the studies allows it to be done properly. There is a requirement to address the consistency, strength, dose response, and temporality of the relationship in the assessment. And another unique requirement is the fact that the applicability to the diet in the New Zealand and Australian populations must be discussed. So this is a key part of the risk assessment process because we need to know the answer to questions like, can the food be consumed by our population in the required dose and within our food and nutrition guideline recommendations? Is the food or food property already present in the population's diet, and how much more is required to get an effective dose? Is the strength of the relationship enough to be meaningful? Will the amount required for the health effect displace other essential foods or nutrients in the overall diet? And we also need to understand what the biological plausibility or the potential mechanism is behind the health effect. So once all of that is done, a conclusion needs to be made summarising all of those points. If, and I mean if, all of this is adequately covered in the evidence dossier, then we will be satisfied that the self-substantiated claim is justifiably made on the food. So we compile a formal evaluation report for every dossier we evaluate, and this is confidential to the company who notify the food health relationship, since the actual dossier is their own intellectual property. Typically, this contains a list of requirements that must be met for the evidence to be considered compliant, and a list of recommendations from us that will help them to improve the quality of their dossier of the evidence when they next update it. So requirements must be met immediately, or we can take regulatory action, but recommendations are simply recommendations that don't determine whether the dossier is compliant or not. So the timing of our evaluations depends very much on what resource we have at the time, and since we only have 2 people in our evaluation team, there can sometimes be delays if notifications come in close together. Sometimes we also have our evaluations externally peer reviewed. However, any delays don't affect the food business who have already notified their food health relationships because it's not a pre-approval process. So the onus is on us as the regulator to ensure compliance as quickly as possible after notification. And because New Zealand exports a lot of food products around the world, we have the requirement for all exported food to meet our own domestic regulations first, including those for health claims, unless the imported country regulations approve claims that we don't approve. And this is my final slide, which is about the ongoing challenges that we face in the substantiation of health claims in Aotearoa New Zealand. Firstly, we would really ideally like to be a lot more proactive than we have time to be at the moment. As I say, we only have 2 people working in this space, so that all food businesses can fully understand all of the requirements and opportunities available for them within the nutrition and health claims standard prior to them planning their research and marketing. And this is particularly important for small and medium-sized businesses that don't have a lot of resources available to them. This requires a lot of resource, which we need to justify in terms of returns to our economy. So we're currently undertaking some research with food businesses here in New Zealand to see how they could be more effectively supported and what the benefits of this could look like for our country. As for all enforcement agencies, there's a prioritisation process for enforcement action. So a non-compliant health claim is not permitted, but action to remove it will rightly never be prioritised over actions to remove more acutely serious food safety issues such as microbial or toxicological contamination or the presence of undeclared allergens. So this is the same all over the world. So non-compliant claims may be on the shelves for a while before they can be removed sometimes. And lastly, remembering back to one of my earlier slides, New Zealand is only one of 8 jurisdictions that enforce this standard across Australia and New Zealand. Given the complexities and the specialist knowledge required to adequately evaluate the evidence dossiers, there are issues with maintaining a consistent approach across all of those jurisdictions, as you can imagine. And so if there is time, I'd love to take some questions.
Thank you very much, Donnell, for these very interesting presentations. I don't think we have questions so far from the audience, but first, let me ask something to you. Is there any kind of procedure for the assessment of the quality of the studies that are, let's say, analyzed within the systematic review? This is the first question. Second one, since, as you said, New Zealand, let's say, from internal demand, internal population is not, let's say, a big country, but it's a very important country for in the international market. So how do you relate with other similar regulatory systems, like, for instance, the European one, but not only the European, maybe the US one? So in order to be, let's say, aligned in a similar way. So first, these two questions, please. Thank you.
Okay. So for the quality assessment, as I said, there doesn't exist a tool. A lot of people like to assess quality in a systematic review just using a tool where you get an equivalent, a certain total number of points, and that determines whether it's a high or a low quality study. But that's not something that we prefer, just because the 6 minimum quality requirements that are within our standard are not normally included. Well, they're not included in any one tool, and they're let alone for different types of studies. So whether it be, I don't know, a randomized controlled trial or an observational study. So we, in our guidance material, give a lot of guidance about what we expect to see. And it's essentially a list of all strengths and limitations, including those 6 minimum aspects. And then actually it does come down to a process of just comparing them against each other to be able to understand which ones are higher and which ones are lower quality. And again, we tend to divide them into high, medium and low, because there's quite a big difference between a high quality, high study and then a medium quality study compared with a low quality study. So we figure that that's a fairer way of doing it. So yes, unfortunately, it isn't a one-size-fits-all approach for that. And in terms of interaction with other regulatory authorities, we have New Zealand Food Safety as part of New Zealand's Ministry for Primary Industries. We have a very established market access team within that ministry, and we, through them, work with a number of other authorities around the world and share ideas about regulation. We also have, specifically for health claims, we have a global group, including EFSA, that we talk to on a regular basis, because we all have the same issues that we face from time to time as well. That's particularly important when it comes to, external peer review of our work, and also when we're looking to alter any regulations.
Thank you very much for these answers. From Alessandro Zavatieri, do companies from New Zealand find it easy or difficult to substantiate health claims in the EU, in the European Union?
Yes, I don't. I know of one company that has applied in both places, but there may be more. I think because we have quite a robust system, it is a little different to the European system, which is also obviously very robust. There are slight differences, but generally if they go through our system, and we don't provide approval, but if we find that they have met all of our requirements, they're much more likely to be able to meet the European requirements. That's not always the case, but I guess the level of the science that's required is the same. It just depends a little bit. It's a little bit different as to how they document that.
Thank you. One last question from Hugo Barragan. Do you carry out work relating to botanical claims? Are they assessed in the same way as general function claims?
Yes. Well, the answer to that is that depends. We have, unlike a lot of countries, our regulations for claims in food are different from our regulations for claims in dietary supplements or natural products. So For food, absolutely, we would expect a botanical to go through the same process as for anything else. But if it is for a dietary supplement, we have different requirements, and that's administered by a different body. Our Ministry of Health administers that.
Okay, thank you very much. Maybe last quickly from Berli Ansari. How about health claims of bioactive compounds in the food products such as herbs, tea, or coffee? Is it permitted to write on the label?
Yes, we don't have any pre-approved claims on those bioactive compounds and those sorts of products, but there's nothing to stop someone from self-substantiating a claim in that space if they can pull together the dossier that's required.
Okay, thank you. Thank you very much, Donna. That was a very, very interesting presentation. Thank you for your availability. Exceptional. Thanks a lot.
Thank you.